welcome everybody to the webinar. I'm Pam Bennett. I'm an RN, and I have a small Medi-Spa in South Georgia, in Douglas, Georgia. We are located about 2.5 hours northwest of Jacksonville and about 2.5 hours southeast of Macon, Georgia, if you are familiar with either of those cities, and we're about 90 miles directly west of Brunswick. I've been in the spa business now for about 10 years. I have 23 years of nursing experience, mostly hospital nursing and teaching. Did some nurse education, also have been in industrial nursing, but had a real dream to do something where I would only see good outcomes, which is every nurse's dream, and got into the spa business in 2005 and have been in it ever since. I started out by traveling all around the country and getting training on individual pieces of machinery that I would purchase, and didn't come across the Aerolase until I think it was 2010, and we purchased the Aerolase the end of 2010, and actually took delivery on it January of 2011. And I will tell you that the Aerolase literally paid for itself in 4 months, which was really phenomenal. So I've got a lot of experience in this business, and I think I've got a lot of experience with the Aerolase, and I find it to be a very versatile laser that just has such great capability. So tonight we're going to be talking about new approaches to laser skin tightening and rejuvenation, and the two really do go hand in hand. So the agenda tonight, we're going to define skin tightening and skin rejuvenation, talk about the science behind the applications, comparisons of various modalities, facial versus body treatments, combining skin tightening with photorejuvenation. If you'll look to the left-hand side of your screen, there is a chat area there. I'm not sure exactly, this is the first time I've done this, but I will try to get to everybody's questions. If you'll just type them in that area, I may not have an opportunity to stop right then and answer them, but there will be a segment at the end where I'll read the questions and then give as good an answer as I can to address them. So the first thing I kind of wanted to talk about is, what do we consider to be skin tightening? It's a reduction in the appearance of wrinkles and skin laxity. I kind of think that skin tightening and skin rejuvenation just are so closely tied that you almost can't separate one without the other. Not if you're talking about YAG. If you're talking about YAG 1064, you're pretty much getting some skin tightening with rejuvenation. When you're talking rejuvenation, and this is the definition of non-ablative skin rejuvenation, it's improvement in the skin's tone and texture to reduce dyschromias, to even out the tone while smoothing the skin at the same time. Just such a large area of improvement with this laser that I can tell you all of my clients just absolutely love it. We seem to have a very good success rate with the skin tightening. You actually can still get skin tightening even when you're only focusing on rejuvenation, just due to the nature of the laser itself. But there are ways that you can focus in and intensify the skin tightening, so we'll try to give you as many pearls as possible tonight on just how to make that happen. So how does skin tightening take place? A device then emits energy and delivers heat deep into the dermis and superheats the bulk tissue through the absorption of water, which leads to the contraction of the collagen fibers. Remember, what we're doing is we're inflicting a wound to receive a response. The difference between this and your average wound is we're controlling the wound. So we follow with a wound response and dermal remodeling and neocollagenesis. So there are a lot of factors that affect the dermal heating, and your device has to have an affinity for water in the skin tissue if you're going to affect tightening. You have to have a relative power output, and you've got to have a relative depth of penetration. And the next slide, which I think is just this, I just get so excited over this particular slide. If you'll notice on the left, you're looking at absorption. Across the bottom, you're looking at your wavelengths. And what this is doing is giving you placement of some of the common aesthetic lasers across the spectrum. So if you'll look over there on the right-hand side, there's a little key. You have to have a chromophore in order for there to be something for this laser hit. It has to have a target. So your targets with a laser are water, and their hemoglobin, and their melanin. And the thing that really sets this laser apart, I feel like, from this huge field of aesthetic lasers that we see, if you'll look to the left of the chart, you'll see a KTP and a pulse dye, and then you move on up and you see, or move on over, and you see alexandrite and a diode, and you see IPL up there across the top, so you're looking at the wavelengths that are covered by IPL. But if you see those two lines that are running through, the red one is hemoglobin and the gray one is melanin, those are the targets that these lasers are capable of addressing. So these are the only targets they're capable of addressing. Then if you look to the extreme right-hand side of the wavelength area there, you'll see an erbium YAG, and you'll see a CO2 laser. And if you'll notice, there's a blue line that represents water, and then there is a red line, and that's your chromophore of hemoglobin. So when you're looking at an erbium YAG and you're looking at a CO2, it has a very, very high affinity for water, and so that's a primary target. And the difference between these lasers on the right end of the spectrum and the lasers on the left end of the spectrum is that these are going to treat the surface. These are ablating lasers. They're used to resurface the skin. And then if you look in the very, very center there, about the 1064 nanometer range, you'll see the ND-YAG 1064. And this is what is so unique about this laser. This is why I'm so excited about it. It intersects all three of those chromophores. So you have a really good effect on hemoglobin, you have a good effect on melanin, and you have an effect on water. And it uniquely puts this laser in a position that no other laser can boast. And I think that is what is so great about it. Up until recently, ND-YAGs typically had a very long pulse width, and there were very painful lasers. It wasn't until the technology improved enough to have the 650 microsecond technology, like the LightPod Neo, that we were able to really get full use out of these YAGs because they're so much more comfortable than they used to be. This next slide is one of the other reasons that the YAG is so impressive to me. And if you've noticed, let's just go back one slide. I just kind of wanted to show you the IPL, and you can see the range that it covers. It covers quite a range as far as the nanometers go, okay? But when you look at the depth of its ability to reach into the skin and affect change, now you can understand why it's not as effective. So with this particular slide, you can see the IPL will affect the epidermis. The KTP will, now you're just reaching into the dermis. The pulse dye the same. Alexandrite were a little bit deeper. Diode were deeper. But ND-YAG by far surpasses all of them. So, now you're reaching into the subcutaneous tissues, and we're looking at anywhere between 5 and 7 millimeters deep into the skin. So it's really got a really terrific range as far as depth of penetration. And all of those things are going to affect your tightening and your rejuvenation of the skin. If you look at this slide, this is just a nice comparison of modalities. So if you're looking at a YAG and a 1064, You've got a high affinity for water. You've got, a good high power range. You've got good depth of penetration with radio frequency, which we are hearing so much about now. You have a moderate affinity for water. You have a high power range, and you have a good depth penetration. Q switch, you've got, variable and low. IPL, you really don't have any affinity for water. You have a low relative power and low penetration. And then you've got the ablating lasers that have a great affinity for water and high power ranges, but they penetrate very, very shallowly into the dermis. So let's just compare probably, I think, the two most common modalities in skin tightening. And, radio frequency is one area that we really need to address. And it's hard almost to separate radio frequency out anymore because so many machines now combine radio frequency with other things. And, sometimes I think that's it's true what they say, and sometimes I think it's blowing smoke because you really don't know which modality is giving you the best result. But when you compare the clinical studies, I think it's really, really clear. There have been lots of clinical studies on comparisons between radio frequency and the YAG. There are just two mentioned here on this slide. And the things that I think I'd like to point out about radio frequency that make them probably a less viable alternative is the unpredictability of radio frequency treatments. Since the very inception of radio frequency back, years ago when even Thermage came out with their first machine, you'd talk with people who actually had the treatment, and out of 5 people having the treatment, you might have 2 who said, wow, I really got a good skin tightening from this, and I'm very happy with the treatment, although it took a really long time to really see it. Then you'd have 2 who would say, I really can't tell this has done anything for me, and it was just so expensive. Would they do it again? No, they would tell you no. And out of the 5, you'd have 1 who really saw absolutely no benefit from the treatment whatsoever. So the treatments are non-uniform. They're extremely painful. They involve costly disposables. Of course, there are the gimmick things where you combine radio frequency with other types of lasers, and it's a combined modality. But you still have increased bruising. You have increased pain levels. You need quite a bit of temperature to do this skin tightening. And if I remember my literature that I have read about radio frequency, I think the skin actually has to reach a temperature of 41 to 43 degrees Celsius for a certain amount of time in order to affect that change. So, there's definitely time for some pain to take place, which I don't think you have with the LightPod Neo especially. In contrast, the LightPod Neo is pain-free, really. No disposables. In fact, the tip of the laser never touches the skin. So there's no contamination of the skin. You get simultaneous rejuvenation and tightening. All of those things to me are huge benefits for the LightPod Neo versus the other machine. Go to the next one here. So just a comparison summary again. Yes, radio frequency energy is concentrated around the electrodes, and I think that's why you have so many problems with bruising and so much pain closer to the electrodes. They're concentrated. The higher the heat, the higher the discomfort, and the higher the probability of injury. The 1064 strongly absorbs hemoglobin. It's contained in the vascular network throughout the dermis. You get a much more even heating of the skin. You also have the benefit of the 650 microsecond pulse, which is incredible. So let's look at and focus in on the LightPod Neo and the clinical cases that we have in the slides for skin tightening. And I think the first one is probably the most exciting one. I believe this is the first case study that I saw involving the LightPod Neo, and I was just extremely impressed with it and just had to see it. And this is kind of a silly little story, but it really is very, very true about when you can expect to see some results from the LightPod Neo. I had the rep came in and actually did a treatment on me because I wanted to see how the machine worked, and of course I wanted to evaluate its effectiveness, and I knew it was going to take a while for collagen to really grow. The first thing I saw probably was a week into the treatment. I really began to notice a difference in the texture of my skin and a more homogeneous skin tone, tighter pores. It felt silky. My makeup went on better. But I just, every night, I would look in the mirror and just analyze my skin and go, okay, where is the tightening? Where is the lifting that I want to see? And finally, my husband reminded me that, you're psychoanalyzing your skin to death. Leave it be and give it a while, and then go back and look at it. And I'll never forget that it was exactly 3 to 3.5 weeks after the treatment that I went to the bathroom that night and washed up and took my makeup off from the day. And this is where the funny part of the story comes in. When you're almost 60, a funny thing happens to you. When you wake up in the morning, you just look so healthy and your skin looks so plump, and your lips are full and your ankles are thin. And when you get home that night, you just have no fullness to your skin. You have very full ankles, but you don't have a lot of fullness to your cheeks and to your jowl line and to your neck and under your eyes. Everything just moves south. And I remember going in and cleaning my makeup off and lifting my head up and looking in the mirror, and I just thought, wow, I look just like I did when I woke up this morning. And I really think that was the first time that I actually saw the tightening and I understood the possibilities of this machine, and that was with one treatment. So we very quickly called the rep back and told him we definitely wanted to move ahead with this machine. And what I'd like to tell you is what I've learned over the past 5 years that I've been using the LightPod Neo, some techniques that I do that increase the probability of the tightening even better for our clients. When you first get the machine, and typically when you're in the training, we learn about that painting method across the cheek, across the area where you're trying to affect some change. And what I have learned is that even if you do a painting method across the face, you're going to get a really nice rejuvenation. You don't have to get really intense to see changes in the red hue of tissue, decrease in inflammation, just a more homogeneous skin tone, decrease in the melanin production. You don't have to be intense to get that. You're going to see that if you do a couple of passes with a 6 millimeter using the appropriate modality for the patient's skin type. You're going to see changes in the skin. But I think we're an instant gratification society, and we all want to see, just like I did looking in the mirror every day after my first treatment, where is it? We're so excited and we want to see it now. And what I've learned just from experimentation with my own clients is there are some techniques that you can get that will actually help you see benefits sooner. So one of the things that I do is I really talk with my clients and find out what bothers them. The first mistake that you can make as a clinician is seeing this person's face and because you do this every day, you know what the perfect face should look like. And so you look at these people and you go, well, I know exactly what I need to do to this face to make it perfect. But you need to remember that your vision of perfection is not the same as the client's vision for themselves. And I'll preface that by saying if you spend a lot of time on a saggy jowl, and you think that that is an area that is just bothering this patient tremendously, and you ignore the slight laxity in tissue that she has under her eyes, and all she sees when she looks in the mirror are bags under her eyes, then you've missed the mark. So I think it's one of the most important things that I could tell you is really know your client. Spend some time getting to understand what it is about their skin that bothers them, because those are the areas that you're going to want to address. Those are the areas they are going to be examining every day, looking for a change. So what I do typically if I have someone who has a saggy jowl, and I think most women my age are really concerned about a saggy jowl, is that I will focus the laser in on that area, and I will, after I have done 2 passes over the face, I'll go back with either the 6 millimeters. Sometimes if I know that client really well and I've worked on them and we're just kind of gotten to a plateau where we're not getting a whole lot more tightening, I may switch to the 5 millimeter lens and use it. And instead of doing a sweeping motion, I'll lay adjacent pulses, and I would say just across the jaw line and just under the jaw area from about well, not quite mid-chin, maybe just the lateral aspect of the chin back to almost the ear. And I will do that until they're warm. And the way I judge if I've done enough in that area, I let the client be the deciding factor, because some people can handle more heat than others. So I tell them, please let me know when this gets uncomfortable. And trust me, when it gets uncomfortable, because they will kind of get this little jerk or nod of their head. And it's time then to finish that pass and stop. That may be 2 passes. That may be 3 passes. I've actually had some clients that really can tolerate 4 well. So when I'm looking for tightening in particular areas, that's what I'll do, is focus in, not stacking pulses, but actually doing adjacent pulses and really trying to cover that tissue, and just slowly moving it, across that area. Now, under the eyes, I will tell you that, of course, we need to use our goggles, and there are a lot of different goggles out there for eye protection. I personally prefer the diopticas that have a very small ocular section that really just fits just into the socket of the eye, and you're able to then almost take a finger and pull that tissue down a little bit. And under an eye, I never do more than 3 passes. I may just really slow that adjacent pulse down, but they can't handle a whole lot of tissue there, not around their eye, or whole lot of heat in that tissue around the eyes. It can get very uncomfortable, and we don't want to cause any damage either. So just 3 passes back and forth with the 6 millimeter, just doing adjacent pulses, and that usually gives a pretty good result. Let's see. Go to the next slide here. Now, this particular slide actually is my patient study, so I can definitely tell you a lot about this lady. And I can tell you that during the year that we treated, or during the first year that we treated this young woman, she lost 86 pounds. She had a difficult pregnancy and had been put to bed, and was in bed for almost 9 months of that pregnancy. Her child was 3 years old when she decided, this is it, I've got to get this weight off. So she did her part. I will tell you that this is not strictly just weight loss. This was a client who did P90X, who got up at 5 o'clock every morning and hit the gym, ate a very, very healthy diet. So she really, really did her part, but she knew she had a lot of skin laxity and came to me asking what we could do. And at the time, I didn't have the Neo. So at the time, we had an older radio frequency machine, which isn't even sold in the States anymore, that was actually an aesthetic, not a medical tool, but more of an aesthetic tool that had radio frequency. And so we did a couple of rounds twice a week, I think 2 rounds during the first year. And, we did get some circumferential reduction in her thighs and did get a little bit of reduction, not a whole lot of skin tightening. And she then, when we got the YAG, she asked me, is this something that we could do on her neck while she was losing weight to try and just stave off having to have a facelift? And I said, there's certainly only one way that we're going to find out, and that's to start treating. So we did. We treated her face and her neck, and she got such tremendous results from it. We did 6 treatments. We spaced them. At that time, we were spacing them monthly. She got tremendous results from it, and then she came to me one day and asked me, this worked so great on my face. Why can't we do this on this saggy tissue on my butt? And, of course, I kind of didn't know how to answer that because I didn't know that anyone was using the YAG at that time on other body parts and had never had that question. But I certainly told her, if it's something you want to do and pursue, we can. I don't have the studies in front of me to prove that it will do the same thing on your buttocks that it does on your face, but I don't see why it wouldn't. Let's try it. So what we did was we treated a 3-inch deep by a 6-inch long segment at the bottom. If you look at her buttocks there on the left-hand side, the picture on the left, I call it banana roll. You see it there hanging at the bottom of the buttocks. And so what we did was our goal was we were going to use the 6-millimeter lens. We were going to do 3 to 5 passes, whatever she could handle. We did not paint. We actually did adjacent pulses and went very slow, and she made it to 4 passes without discomfort, and then said, that's really about it. So I was happy with that. She wanted to know how fast we could do this, and I said, I just don't know. This is uncharted territory. We're going to have to come up with our own routine. She wanted to attempt to do it on a weekly basis, so we did. We did 10 treatments. And I would say give or take a week because there were 2 times when she did not make her treatments on time and we had to go a little further than a week out and kind of messed our schedule up a little bit. But after the 10 treatments, the result we got was on the right-hand side. Now, I will tell you that she continued to do her exercise, so she really continued to do her part in this. And I think that's really, really important. If you're going to attempt body tightening, you have to choose the right client. And that right client understands the concept that this is a lifestyle and they have to do their part. So this client still to this day leads a very active lifestyle. And as a matter of fact, we actually did a little YAG on her bottom side this past week. She'd gained a little weight and had tried to lose it again and said, let's just kind of do some touch-ups. And so we did, and she still looks great. I mean, we're very, very happy with the results on that. This next slide is not one of mine, and sometimes it's really hard to see skin tightening on a picture, and I think it really is a little difficult to see with this one. But I think I can actually tell you if you will look at the love handle area there at the top of the buttocks on the right-hand side, that's where I see the biggest example of just a nice tonicity to the skin. I mean, it's just nice. And this, if you'll see at the treatment notes were 1 pass with the 2 millimeter at 96 joules per square centimeter. I mean, that's just fantastic. I don't know what technique she used. I would imagine with a 2 millimeter that she might have been putting a little, spacing a little bit because that would have gotten pretty hot. And typically we like for people to be comfortable. But I will tell you this, we say that this is a very comfortable laser and that there is no cooling required, and there isn't. I've never had to stop and cool. But I will tell you that for patient benefit, I would offer a gel pack or frozen peas if they got uncomfortable. I've really never had anyone get to that point. I like the frozen peas because they conform to the body. They're easy to lay up on an area, and they just kind of mold to it. So that works well in our practice, and that's what we use. But as far as comfort, this is probably one of the most comfort things you can do with skin tightening. This next slide is actually the underarm tissue, and we actually did underarm tissue with the same client that we did the buttocks with. We did the buttocks, and she loved that so much, then she wanted to move to the underarms, which were quite jiggly. And, of course, she was doing an upper body workout as well and was having good luck with it, but she still had quite a jiggle. It's really hard to translate that into pictures, and I tried and could not get a picture that just really showed the satisfaction. But if you look at this picture, if you look at the very bottom of the upper arm there, I think you can see even towards the underarm, there's just a better tone to that tissue. It's as my client would put it, it's in the jiggliness. It doesn't jiggle as much as it used to. So she was quite happy with her treatment. So if now we take it the step further and let's talk about rejuvenation for a minute, because like I said, you're getting skin rejuvenation along with tightening, and it's really a no-brainer. You'll see that will come very, very easily. That's probably the first thing that you see. So if we look at laser rejuvenation, again, a laser emits the energy. It superheats skin structures like melanin, hemoglobin. It breaks down the structures so that they can gradually be cleared by macrophages. This reduction of dyschromia results in an improvement of skin tone. And in the homogeneous skin tone, it's just such a nice homogeneous color. You get a lot of redness reduction. Sometimes people don't even see themselves as having a redness to their skin, but they'll come back the next treatment and say, wow, I never really thought I had red skin before, but that really got the redness under control. They're very, very happy with it. Now, with pigment, what you see in terms of rejuvenation, even with the 6-millimeter lens on, if you've got somebody that's a skin type 3 or lighter, I'm using the Program 8, which on my machine, which is a 2010 model, is 28 joules per square centimeter. And I have really, really good results with that. What I tell them to expect in terms of pigment is if they just have just a little bit of pigment, and it's pretty light anyway, you're going to see that just even out over probably 2 or 3 months. Just gradually, you just see a nice lightening to it. Now, of course, you can treat it intensely, and you can. I'll actually treat some with a 5-millimeter and some with a 2-millimeter. And if you're treating specific spots, which we'll address that later on in the presentation, you'll need to get pretty intense with it. You want to see a change in color. Let's see if we move to the next slide. So, let's look at some of the modalities for skin rejuvenation. I like combined modalities. I use combined modalities all the time. I think they really give us the best overall way to attack skin rejuvenation. In terms of topicals, I'll start right now by saying when people come into our spa, the first thing they get is a really nice lecture about their skin care. They really need to be using a good skin care system, and I have to teach these people what do we mean by a good skin care system, because they're used to walking to the drugstore or to Walmart and they see vitamin C and they think, oh, wow, vitamin C, I've got something great for my skin. And they're going to use it. But what they don't understand is that not everybody knows how to deliver vitamin C where it needs to go. So I that's one of the first things that I do is counsel them on that, and I'm going to give you just an example. I think it puts it into perspective when it brings it down to the patient or the client's level of understanding and something that they can relate to. So I like cars. I'm a big car person. And I tell them, to me, when you go to Walmart and you go to drugstores and you pick up these little cheaper over-the-counter products, and I'm not going to use any brand names to tell you, but you know which ones they are. When you do that, you're really riding in the the Volkswagen, the bottom line, baser model of vehicle. And then when you graduate into things like the department store counter type skincare, to me, you're in the Cadillac now. You're in the Cadillac. I mean, they're a little bit better at delivering. They know a little bit better about how their delivery systems work. They have R&D departments that are just so specific, and this is what they do. And then when you move into a cosmeceutical or pharmaceutical level, now you're talking about the Rolls-Royce Bentley. This is an example everyone can understand. And the perfect example is that vitamin C. If you pick up an over-the-counter product at Walmart and it says it's got vitamin C, I'll guarantee you it's not vitamin C at a 20%, at a pH of 3.0, which we know scientifically is the best optimum vitamin C to penetrate the skin and do what we need for it to do and go where it needs to go. So, to me, that's a big deal. So I start by making sure that my clients have the best skincare because that's going to be the basics for everything. All right, and then in terms of topicals, we keep on hand things like the hydroquinones, the retin-A's. We keep all of our skincare, consists of antioxidants, AHAs, BHAs, polypeptides. These are all just essential for a good skincare system. Now, we also use microdermabrasion, and I will tell you that I like the combined modality of microdermabrasion and chemical peels with YAG. We still do something called an omnifacial that our people just love. We do a medical-grade microdermabrasion, and then we follow it with a YAG treatment using 6-millimeter lens. Usually it's on about 21 to 28 joules per square centimeter. We do not do 3 passes. We do 1 pass with the microdermabrasion. We do 2 passes with the YAG, and then we do 1 layer of an alcohol-based Jesner. Send them home with that, and they just love it. They absolutely love it. They say it gives them a magnified result. So, that's something that you could do. Of course, we've got laser and we've got IPL. I mean, IPL is another treatment that will, do adequately for just the surface of the skin. You're talking about redness in the skin, pigment in the skin. You may see some tightening of pores with it. The nice thing about the LightPod Neo and the Indy YAG 1064 is not only will you see the redness disappear and you'll see the pigment even out, you'll see the pores shrink, but you'll get that tightening, which you can't get with IPL. Of course, we still use toxins and we still use fillers. Those are great. They're not really for the surface tissue rejuvenation. Our neurotoxins are going to relax the muscles, and that's always a great thing. And that's one of the reasons why we love the polypeptide system so good. I know y'all are probably familiar with that, but, the greatest thing about the hexapeptides and pentapeptides is their slow and eventual interference with the acetylcholine. It really has a Botox-like effect if used long-term. And then we do fillers. And I will tell you that there is no evidence to show that there's any breakdown in fillers or toxin or, any neurotoxins by using laser energy. In fact, the nasolabial area before we inject with a hyaluronic filler. And there was a study done, and I'm not sure if it's Dr. Kipreves's study or not that showed this, but there was a study done where they actually showed that you get exponentially more collagen production when you start with the YAG, finish with the fillers, than using either modality alone. And I wish I tried to find that study. I know I have it somewhere on my computer, but I was unable to reference that for you. Maybe Aerolase might have it. The LightPod Neo pre-treating also has that benefit that it'll minimize bruising, and it does minimize swelling. I mean, it's there in the study. There's a white paper done on that. You can request that from Aerolase. I'm sure that they will be happy to supply that for you. So Modalities in skin rejuvenation, of course, topicals, microdermabrasion peels, injectables. You know, those are targeting the uniformity of the skin. You know, with the injectables, textural, the uniformity, and also volumizing. You know, places where you have just total lack of volume and structure in the skin. Laser or IPL treatments are really needed to target reds and browns. You're not going to target those, you know, any other way, really. You may be able to target some browns with chemical peels, but not significantly, not as significantly as you can with laser. So, again, I would just want to reiterate that the lasers do not affect toxins and fillers. They really complement them very nicely. I've always had people, you know, ask me that in training sessions before. Well, you know, isn't this a bad thing to do? Won't it break down the filler? It doesn't. It really doesn't have an effect. Let's see. The mini targets for laser rejuvenation. Okay, rosacea, foremost and primary. I have many, many, many patients who have rosacea, and this is probably my favorite modality for treating rosacea. I like to use heat. You do need a little heat. When you're talking about something that's vascular, it takes a little bit of a heat. I slow down the painting process with people with rosacea. I actually will go back and stack in certain areas if they have a lot of redness. I like to work on the diffuse redness first, and I usually see these people about 2 to 3 months in a row. And, you know, sometimes, ironically, I won't see them again for a year after treatment. And I was asked one time, you know, why don't you hit the larger vessels first? You know, I suppose you could do a spider vein treatment on the face, but I like to shut down the redness, and then I really can see what's left. And then after we have shut down the redness, we'll go back and do a spider vein treatment on their face. Sometimes we do a couple, depending on how many vessels they have. The only drawback I see, or the reason it might take a couple of treatments with the spider veins, is once you break out a 2-millimeter lens and you start treating a spider vein with, especially in the face, with a laser, you get a lot of an inflammatory response around the area, and sometimes it obscures your visibility of other vessels. So you get what you can, and then, you know, the rest you'll have to address at a different time. Poikiloderma, you know, I like combined modalities with poikiloderma. I'll tell you, I have some of the best results doing the laser, and I'll start with a 6-millimeter just to make sure that they tolerate it well, and if they tolerate that, the next treatment we're going to a 5-millimeter. With the poikiloderma, I personally like 15% to a 25% TCA peels if I've done peels on them before and I know how they tolerate the peels. If you haven't done peels on them before, I would definitely recommend you do a couple of peels with something a lot lighter just to see how they tolerate it. But we use an alcohol-based 15% TCA for our first TCA peel on them, and we see a big difference in poikiloderma doing a peel this time. 2 weeks from now, we'll do the LightPod Neo. 2 weeks from then, we'll do a peel. 2 weeks from then, we'll do a LightPod Neo. We see them resolve pretty quickly that way. Spider veins, again, great for spider veins in the face. Again, the only thing in the face that is an issue is the fact that when you're moving up that vessel, you don't want to stack pulses. Whatever you do, don't stack pulses. You really need maybe the size of a 2-millimeter space between each pulse. And when you're doing this on the face, it will get uncomfortable. But what you don't want to do is pre-cool. And I will tell you, people make that mistake. Think of what you're doing. When you pre-cool, you are causing vasoconstriction. So you want that vessel engorged with hemoglobin. You want the target to be there. You don't want to chase the target away. So I wouldn't heat it, but there are some methods that you can use that help to cool things down. For one thing, I will work on that vessel, and then I'll put my repetition on the foot pedal is what I'm using in our treatment room. And I'll put the repetition on about a 1. That just gives me time to move that spacing and let that first shot cool just a tad before I hit it again. And then if I have someone who's ultra sensitive to that, I may do a single pulse, and immediately after the pulse, take my thumb and press my thumb to the top of the spot where I have just hit the vessel. And I'm not sure whether it totally interferes with the nerve ending's ability to register the pain, or whether you really get a conduction of some of the heat into the tip of my thumb. Whatever it is, it works. So I do that quite a bit. And another thing that I'll do when people just get really, really hot in one area and you're working on an area that has a lot of broken vessels on the cheek is I'll stop and go to the other side, work for a few minutes, and then come back to it. Sometimes you have to just give them a little bit of space and time. Angiomas, the lasers are just wonderful. The nice thing that'll almost sell people on coming back and getting a spider vein treatment and getting angiomas on their abdomens or their chest or their legs taken care of. If you see something on their face while you're doing a photofacial on them or just a rejuvenation session, just change out to the 2 millimeter and just say, you know what, I'm just going to take care of this for you. And, hit it one time and just comp them that. And it's amazing. They'll come back and say, when can I come and let you do all these spots on my chest? Well, that's for another day. When we started out using ours, and a lot of people don't quite know how to charge for things. One of the things that I do is if I'm in a session and I'm doing skin rejuvenation and they're more concerned about redness in their skin and pigment, and I'm using a 6 millimeter and I'm not really doing skin tightening, but we're doing a rejuvenation session, if I have to remove the lens and replace it with another, it's an upcharge. And that's kind of the way we deal with it. I've had people tell me they do a lot of different things. Let's see. I have some people who consider, an omnifacial with the laser alone being the use of all 3 lenses. So, that's another thing that you could use. Bruises, it's great post-injection on bruises, and I think we'll have a slide to illustrate that in a few minutes. And I will preface that by saying not only bruises, but outright wounds. I shared a story with somebody the other day. I presented a lecture at the PHRC in Miami a few weeks ago, and about 2 weeks before the lecture, every woman wants to look nice while they're standing on a podium, and maybe 100 people are looking at them. And I had bought a new dress and new shoes and, was headed down to this meeting. And 2 weeks before the meeting, I actually fell. I don't know how I did that. Greg says I could fall off my flip-flops, and I would imagine that's probably what I did. But I fell into a step on my garden tub, which is tiled. And apparently one of the tiles was chipped on the edge. It literally tore a gash in the lateral aspect of my right ankle, and so badly that I literally had a Telfa pad on it that was soaked with blood an hour later. So, I was thinking, okay, what am I going to do now? I'm probably just going to have to wear pants. I had already had my outfit picked out and everything. And then I thought, no, I'm going to use the YAG on it and see if I can just use the wound healing protocol and see if we can't affect some change. So I started out the very next day, and within 2 weeks, I had full closure and no scab, and the skin was still just a little bit on the pink side. I think if I had really pushed the treatment, I probably could have gotten better with that, but I was quite happy that I didn't go with my leg looking like it was shredded. Redness and scars, I will treat that ankle some more. There's still a little bit of redness there. It was such a deep gash. So Redness and scars, this does a beautiful job on redness and scars. I think when you're dealing with people with scars, though, you really need to ascertain what their expectations are, because sometimes when people are treated for scars or even stretch marks, what they really want is for this tissue to look like virgin tissue again. That's not possible. It's just not going to happen. Acne, that's another target that is great for the Light Pod Neo. With acne, you're looking at those microvessels near the sebaceous glands. It really just creates an environment that bacteria just doesn't appreciate living in, and it decreases the inflammation. Usually when I do an acne treatment, they look better before they leave. I mean, it's really incredible that they look better. Port wine stains are great targets for skin rejuvenation, and psoriasis as well. I've seen a lot of improvement with not only psoriasis, but I have people come in with eczema, and we've treated some eczema and had really, really good response just with a decrease of inflammation. Melanin-rich targets, the sun and the age spots, the melasma, post-inflammatory hyperpigmentation. Boy, do I see a lot of that. I see a lot when people have been other places and had treatments that were maybe not right for them. And, post-inflammatory pigmentation is a real issue for a lot of ethnicities. So my standard for post-inflammatory hyperpigmentation and how not to get it is something that I did want to share with you. If I have a skin type and an ethnicity that are prone, Asian women are prone to post-inflammatory hyperpigmentation. Indian women are prone to it. If I have someone that I'm treating, I will literally give them or sell them, in this case, something called Aloe Court. I know there are several different companies that make it. It's really just an aloe gel cream with 1% hydrocortisone mixed in. And what I've found over the years of treating these people is that after treatment, if they will take a little bit of that cream and apply for about 7 to 10 days post-treatment, and that's with lasers and peels and medical microdermabrasion, I see less likelihood of them developing post-inflammatory hyperpigmentation. I'm going to move on to the next slide. The clinical cases of skin rejuvenation with the Light Pod Neo. There's just the perfect example. I love this. After one treatment, look at the reduction in redness that this lady has achieved. It's just incredible. It's just one of those treatments that you see probably within 2 weeks. They see a drastic difference in the redness in their skin. And again, rosacea is such a unique thing to treat because some people it just takes one treatment, some people it takes 2 or 3, some people their retreatment interval may be yearly, some people it may be every 4 months. So there's such a variability there, and I always recommend along with it that they join the Rosacea Society, which they can, and that they keep a food journal. And, this is something that can really help them to identify their triggers, because there definitely are triggers. And also, I recommend they use green tea cleansers, products that have green tea, caffeine. Those tend to be just really, really good. And zinc, I put them in a sunscreen. I keep them in an all-natural sunscreen, no chemicals. I try to make sure that they have as many natural products as they possibly can. Let's see the next one. I'm going to stop here for just a second and look at some. I'm just totally ignoring the chat session over here, and I'm sorry if I don't get to you. I will at the end. Let's see. I'm just going to take a second to read a couple of these. Okay, I had one person who wrote in and asked, do I feel that everyone is a candidate for tightening on the body? And you know what? I don't. I don't feel that everybody is a candidate. And I would say that simply because I wouldn't want you to set yourself up for failure. And to me, if you have somebody come in and they are in terrible physical condition and they're morbidly obese and they want skin tightening, I would really question what their motivation is, because I think what they're looking for is a miracle and they're not going to find it. Skin tightening is really, I think, done better in targeted areas. For instance, the love handles. For instance, the loose tissue under the arm, the loose tissue around the jowl area, the loose tissue at the bottom of the buttocks, small specific areas. You cannot, treat this poor person who's morbidly obese and expect that you're really going to have a good result and that it's going to satisfy them. It's not going to be cost effective for them to do this treatment at this time. And I will preface that by saying that the client that you saw the buttocks on, we actually did not treat her abdomen because there was so much laxity there. I knew it was going to require skin revision. And I felt like for her, a better choice would be do your skin revision and then let's deal with the scar tissue and do any residual tightening that we need to do at that time. And that's exactly the way we handled it. Then I had a question that said, I had a client mention her fillers lasted longer while doing the skin rejuvenation. And I think that either they are lasting longer because if you're doing skin rejuvenation and if you're getting tightening with that rejuvenation, you got to remember you're constantly stimulating that collagen production. Remember that with collagen induction therapy, anytime you inflict a controlled injury to elicit a response of increased collagenesis, you are getting that increased production for about 6 months. So, yes, you can definitely see a better result with your fillers if you're doing skin rejuvenation along with it. Time interval between treatments, someone asked. If you're talking about doing skin tightening on the face, I tend to do 3 to 4 weeks in between treatments. I like to see what I've got from the previous treatment, at least see some changes in the skin. And, it takes a while to see that. I mean, it took me about 3.5 weeks before I really started seeing a lift in the jowl area and a tone difference, an elasticity difference. You could definitely see it. So I tend to, and to me, when you think about your client as well, I don't practice in a real affluent area. The median income in the county where we live is about $40,000 a year. So this is not a real affluent area. And these are real women that are coming to me. And it fits in with their philosophy better to give them something like this once a month that they can budget into their finances, and it seems to work better that way. Let's see. The question is, will you be sending these slides for our reference? And, I don't have the answer to that. I don't know if they planned on doing that or not, but I am sure that if you would contact Aerolase after the webinar, that something can be done to get those slides to you, or they may have them posted on the website. That may be the way it works, but you should have access to them. Yes, ma'am. Let's see. Will the laser help with underbulge or fat pad dislocation? Ooh. I don't know the answer to that. I really don't know the answer to that. We'll have to refer that to somebody that's got maybe a little bit more experience with it than I do. Let's see. We talked about the intervals between the rejuvenation treatments. I will tell you the only thing we've gone over, I think, so far that is any different that I do more than once a month. If I were doing spider veins, I would not do those until when I do a treatment, I don't see them back for spider veins for 8 weeks. Now, the rosacea, the diffuse redness, yes. But spider veins, no, because even up to 8 or 9 weeks, you may still see some resolution in that vessel. And if you really don't wait, you're going to be retreating something that you may not need to retreat. So with that particular instance, I would do every 8 weeks. Okay, I'm going to stop here with the questions for a minute, and let's just move through some of these slides. Let's see, poikiloderma. This is a nice slide on the poikiloderma here. And again, my philosophy on that is that they get a treatment, and then 2 weeks from then they get a peel, and then they get a treatment, and then they get a peel, and we space them every 2 weeks. Works well on poikiloderma. I think it's a no-lose situation. They definitely see improving. It's a slow process with poikiloderma. It's a persistent process, but there is a light at the end of the tunnel. Here we have the facial veins, perfect example of what we were just talking about. I wouldn't retreat this again for 8 weeks because, again, you could have that resolution very, very nicely. Okay, legs. Let's look at the legs here. My protocol with legs is always going to be sclerotherapy first. To me, it's a less intense treatment. It clears an entire area, so quickly. I wait until after resolution, at least 8 weeks after I've done sclerotherapy. I bring them back and do cleanup with the laser. It does a beautiful job. Here's a good example of the bruising. So this is 2 days after one treatment. Now you can see her bruise is pretty far into the process there. You can see the color changes. So, that probably is something that she could have started treating a little bit earlier, but she probably, just didn't even realize it. But it does a great job with bruising. Okay, here we go with the scar revision and striae. This is something that I would caution you again about your client's expectations. You can reduce the redness in the striae themselves, but you are not going to make this disappear. It is always going to be there, and it's been my experience that what they really want is total resolution. So just be sure you do really good education with your client. This is a scar revision, and my understanding is that this particular one was almost treated like a lesion with a 2 millimeter and almost burned off and then remodeled. And it works well. I think the Neo does a really good job on scar revision. If you're working on the redness in scars, does a terrific job. But this one was, I think, more treated like a lesion itself. Let's see. Give me just a second to get caught up here. Okay, now we're going to move into acne very quickly here. This is really a terrific treatment for acne. Number one, you want to know what the underlying cause is. Is it bacterial? Are we just dealing with inflammatory acne? Does this client have PCOS? If they do, that's a big thing for me. If they have PCOS, that needs to be addressed. The PCOS needs to be treated. And we do really well with the laser. With the acne treatments, when I first start seeing them, I'll have them in every 2 weeks. Sometimes I use a painting method with a 6 millimeter lens. Sometimes I will go back and follow that with a 2 millimeter and hit individual pustules with that. And it's not just one hit. It used to be we thought just one zap with a 2 millimeter into the pustule itself, but I'm beginning to realize that over the years you have people that do better with, you build up a little heat there. If you can build up that little bit of heat there, you do better. A lot of times I will also put them in an oral zinc with a B5 if they have cystic acne. That seems to calm it down. 30 to 60 milligrams a day, probably 5 or 10 milligrams of B5 does a good job. Depending on the severity, like I said, I'll see them twice a week to start. As soon as we get things calmed down, we move to once a month. Or I said twice a week. I meant twice a month. When they get, to the point where this lady is on the right-hand side, sometimes I'll even recommend using combined modalities with microneedling. And what you're looking at with the acne, again, is bulk heating of the sebaceous gland. You're going to destroy P. acne. You're going to slow sebum. You're going to clear blocked pores. In terms of treatment, I would put them on a glycolic salicylic cleanser so that you're getting exfoliation and reduction in sebum constantly in treatment at home, and it's going to reduce inflammation. And for guys, when you're doing acne, you always need to warn them because there may be some loss of facial hair. So that's something you want to think about. And in this particular case here, we're seeing nice clearance on a darker skin type. It works just as well for darker skin types as it does for lighter skin types. It's just wonderful for any skin type with active acne. Then we're moving on to the actual, really what I consider to be focal pigmentation, areas of pigmentation that you just need a little extra treatment for, and we talked about that. You'll get a diffuse lightening even if you're doing just a skin rejuvenation treatment with a 6-millimeter lens over time. But if they've got something that needs intense treatment, I would move to a 5-millimeter and then a 2-millimeter, and you need to darken the lesion. So the darker the lesion, really the lower your energy fluence needs to be. But you got to see that lesion darken some. If you darken it, it's going to lighten. And then post-care, I always put them in some sort of recovery ointment, Aquaphor or something like that, so that they don't traumatically, if it scabs, they don't traumatically pull it off. With hands, a lot of people are getting their hands done. I love the hands done, but I really recommend they're done at least once a year after the summer months. We just can't keep them out of water, and we can't keep them in sunscreen. But it does do a good job, good clearance, and it also gives you a nice, healthy collagenation on the hands as well. Here's another example of a lesion, and if you were to look really, really close at the removal of this lesion on the right-hand side, you would see that there is a little difference in that tissue. This is a case where a little tiny bit of scar tissue or hypopigmentation may be beneficial because it's more attractive than looking at the single lesion that tends to draw your eye. So that's always a decision that has to be made. If you're looking at this next slide, we're talking about pseudofolliculitis, Barbie. It's just a wonderful treatment. Your only issue here is that this gentleman needs to know he's going to have reduced hair in this area. And I've had several of them actually come in like this with a Fu Manchu on and say, okay, do anything except that. I want to keep that. And so we'll just kill everything. We'll kill the hair and eliminate the inflammation, and they get pretty quick resolution after the treatment too. Melasma. Here's another good example of this pigment. With this particular slide, you still see just a little bit of the diffuse color here, and that's the problem with melasma. We all know that it's a persistent thing, and so it'll probably require retreatment, and it will require measures to prevent its reappearance. Pores, non-ablative lasers, can improve skin texture, including shrinkage of pores and smoothing of fine lines. If the energy is partially absorbed in water, and we know that the LightPod Neo has that ability to to affect water, so we get a nice tightening with it. This is only true with a 1064. This is a nice picture again of acne scarring, and this is you can actually see here we probably got some post-inflammatory hyperpigmentation here that's been dealt with on the nose. This one was treated every 2 weeks for 14 weeks, combined with microdermabrasion, so you have a good resolution of the scar tissue. What about deeper wrinkles and acne scars? That's when you're moving to an ablative laser. And if you remember the joy of that slide I showed you back in the beginning on that continuum, the erbium YAG does a great job on resurfacing that tissue. And, of course, Aerolase makes a wonderful erbium YAG. The ERA does a great job. These are some of the pictures of the skin resurfacing with the ERA. And you can see the beautiful homogeneous skin tone you got with that. This lady had a thread lift, and I honestly think this is a super shot of this, because you can really see the difference in the depth of the wrinkles, and part of that is due to the thread lift. But you can see even around the mouth, around the corner of the mouth, that she's had a good result, even with the era. Okay, so the versatility of the LightPod lasers. LightPod Neo with the 1064 energy simultaneously provides tightening and rejuvenation, and it can be combined with any other rejuvenation modality, including the ablative resurfacing with the era in the same session, simply because of its gentle nature. So you really have a complete system if you have both of them. I don't know how many of you listening in have both of these machines, but they certainly complement each other beautifully. All right, I'm going to try to answer some of these questions now, and I'm sorry if I'm losing some people because of the late time. Let's see. Well, the laser. Okay, let's see. Well, I'm going to. There's a comment here. I thought spacing treatments too closely could break down collagen instead of stimulating. As you can see by the evidence of the picture of the buttocks, we actually spaced it weekly. I think there were 2 instances where we actually went 10 days instead of weekly, and it gave us a beautiful result. We certainly haven't seen any breakdown of collagen. We've certainly seen tightening in that tissue. But when I'm doing facial tightening and facial rejuvenation, I typically do once a month. And that's about it. I usually leave about 4 weeks, and I have really good results with that. Is a question here about how much do we charge for skin tightening and rejuvenation. We have an omnifacial that runs $300. We're in a very depressed area, and I'm going to tell you that I've seen prices anywhere from $200 to $500 to $700 across the country. I talk with people every week about how to price their laser. You know, this is something that you want to really consider very, very carefully, because you don't want to underprice yourself for your area. So I would suggest that you do some callings, call some competition, find out what they're offering, if there are any specials. If you have Groupon and they're doing this on Groupon, you certainly need to be aware of what the pricing is on Groupon and price yourself accordingly. The parameters for post-injection bruising, that's variable too. And I will tell you that I've had someone come in, and I've actually had a lot of, it's a really, really fresh bruise, and there's a lot of just blue and red in that bruise. I always do a 6 millimeter lens to begin with, and you're somewhere between 21 and 28 joules for a pass. If I'm doing anything lower than that or a darker skin type, I may use something around 14 to 21 joules. But it really varies. It depends on how much bruising is present, how soon the bruise was brought to me for healing, all of those things. And there's a please send the parameters for all of the conditions. And if you have a LightPod Neo, you'll have a protocol book that will have those parameters in that book. Most of them are very specifically written out. If you have a question about a particular parameter in general, feel free. I'm perfectly happy for Aerolase to share my number if anyone would care to discuss anything in particular with me. But most of the protocols are in the book, and if you follow them, you'll be going in a good direction. Somebody commented here that they had a client who had fillers, and she felt like she deflated after the laser rejuvenation when you treated her several weeks after the filler was placed. Why would that be? That's a really good question. If you think about it, number one, she could have had some I don't know how many weeks after you treated her, but she could have had some residual swelling from the actual filler. That's one issue, because a lot of times you'll see swelling for 2 or 3 weeks, and then all of a sudden it's like, oh. But I will give you one thing that she may not have considered, and you may not have considered. If she was using a hyaluronic filler, they hold up to 1,000 times their molecular weight in water. And if you are dehydrating your skin and you're not taking care of your body and giving yourself plenty of water, not Coke, not tea, not coffee, but water to drink, and you're living a good lifestyle, then that filler will stay very full. I oftentimes, especially doing lips, have people call me and say, I don't understand it. I had my lips done 3.5 months ago, and they're just droopy. They just don't look like there's anything there. And I'll ask them, what did you have to drink? What have you been drinking? Have you been hydrated? And they'll say, oh, well, I had a couple cups of coffee yesterday, da-da-da-da-da. And I will tell them, I want you to go home, lay off everything but water, drink a liter of water today, call me tomorrow and tell me what your lips look like. Tell me what your nasolabials look like. They will invariably call me back and say, oh, my God, my filler's back. I mean, it's crazy. It's crazy how they just forget to stay hydrated, and it has a definite effect on how the filler looks. Do darker skin types get the same benefit from the skin rejuvenation and tightening? Yes, and I have several darker skin type patients. I have patients from a 2 to a 5, and a deep 5 at that. And yes, they have incredible benefits. In fact, I almost think my really dark skin types see the tightening and the rejuvenation quicker than I do my lighter skin types. And of course, you don't have to use as much fluence with the darker skin types as you do the lighter skin types, but absolutely yes. Well, that's the last of the questions. I hope I covered them all. Again, I appreciate all of you that have been here, the ones that have hung in with us. If you would like to address any questions additionally, I'm positive that Aerolase has my email address and my phone number, and they are more than welcome to share that with you. I'll be just as helpful as I can in sharing any of the individual cases that you might want to discuss. Thanks again.